Thank you, Governor. Good afternoon. We're certainly very pleased about the data dashboard that the Governor described. There are armies of people at the Rhode Island Department of Health and throughout state government who have been on the team doing an enormous amount of work behind the scenes to get numbers to you every day. I know that's what allows me to say with confidence the numbers that are extremely vast in what's being collected in a very quick amount of time, that there's a super strong data team working hard to make sure those numbers are as close to accurate as possible. I want to really take a moment to acknowledge them and thank them publicly. They know who they are. As is visible on the dashboard, we have 278 new cases and 7 new fatalities, unfortunately, to report. 4 of these fatalities were people in their 80s, 2 were people in their 90s, and 1 of them was older than 100. These are people that are loved by families, and we extend our condolences to them. Of these 7 individuals, 6 were nursing home residents. As the Governor and I have discussed, nursing homes and other congregate care settings remain very challenging for us in Rhode Island and a top priority to help address. They are also challenging environments for states across the country. We have a number of interventions in place and in the works to continue to focus on preventing transmission in nursing homes and other congregate settings, and to make sure that people get the specialized care that they need in these settings. We have core infection control measures that we are very aggressive with. We have testing strategies, some of which the Governor mentioned, many others that are also occurring in these settings as we continue to engage with nursing homes and other congregate settings. We have cohorting strategies to be able to safely care for COVID-positive patients while caring separately for the COVID-negative patients and helping the staff be able to care for those individual cohorts or groups of people in ways that make it so that there is not an exchange. And as I've mentioned before, to also be able to limit the different types of people that interact with the residents so that we can support individuals, we can support nursing home facilities to have one individual who's able to perform a number of tasks while engaging with that resident. So we'll continue to share updates with you all as we continue to apply thoughtful, aggressive measures that are needed, knowing the priority that our nursing home and all of our congregate setting environments are for us and for Rhode Islanders overall. Separately, I want to take a moment to discuss the cloth face coverings. Yesterday, the Governor announced an executive order about cloth face coverings. That executive order states that all employees of customer-facing businesses, office-based businesses, manufacturers, and nonprofits must wear cloth face coverings when they're at work. I want to clarify and emphasize that we are talking about cloth face coverings, similar to what the Governor shared yesterday and what I showed we've made creatively, thanks to my husband. We are not talking about medical masks like N95 or surgical masks, which are what healthcare workers are using in their specialized settings. We are talking about cloths. That could mean a scarf, a bandana, or something improvised from home, whether it be a t-shirt or another piece of cloth. Our goal is to limit or prevent the spread of respiratory droplets when people are in the community and in public. So you wearing that helps protect the people who are around you. It is important to wash your cloth face covering frequently, ideally after each use, and at a minimum, at least daily. And like yesterday, I want to reiterate that these cloth face coverings are not replacements for the other measures that we have been talking about that are critical, like not being in groups, washing your hands throughout the day, and absolutely staying home if you are sick. That's the primary way that this virus is transmitted, through symptoms from one person to the next. If you stay home, that is how we can stop the viral transmission from occurring. We are also saying that because there are times, as we're learning with this virus, that someone may feel well, be without symptoms, and still be at risk of transmitting illness. Stay-at-home order is in place specifically to address that, absolutely for people who are ill, but even if you're not, you should be working from home as much as you can. If you need to go out, it's only for those critical needs, to work and back and staying home. The cloth face covering makes it so that even if you are feeling well and there's risk that you may have transmission of illness that you're not aware of, wearing a cloth face covering will help to limit that. We've heard that some people are having a little trouble making cloth face coverings at home, particularly people who may not have access to the internet. If you are not sure how to make a cloth face covering, you can call our COVID-19 hotline. That number we've been sharing is 401-222-8022. There are many creative ways, similar to what I showed yesterday, and many others, to be able to make a cloth face covering that you can use. It's really just about being able to cover your nose and your mouth. Call us at our COVID-19 hotline, 401-222-8022. We're here for you. We are a resource for you. And don't be afraid to reach out for anything if you need help, whether it's this or what the governor mentioned earlier today.